Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
these are the drugs which will reduce mania, which are used in acute mania, like lithium, sodium valproate, carbamazepine, atypical antipsychotics. Lithium is the only mood stabilizer. It is the only mood stabilizer which has demonstrated to show effect on reduction of or reducing suicides. So this is lithium. Then one more important thing about lithium is this lithium can also cause benign and reversible. It causes benign and reversible flattening of T waves as side effect. It causes weight gain. Okay. And one more important thing about lithium is lithium has narrow therapeutic index. Lithium has narrow therapeutic index, and this lithium is not given alone in acute episodes. It is not given alone in acute episodes. Has onset of antiemetic action is slow because onset of antimanic action is slow. So lithium is not given alone in acute episodes. So because lithium is not given alone in acute episodes, along with lithium we will have to add either benzodiazepines should be added, or we should add either the anticonvulsants, benzodiazepines or anticonvulsants, or atypical antipsychotics should be added to mania while you are giving lithium while you are giving lithium for acute therapy. Then thank you for watching.
Thank you and thank you for watching.